When you first hear the words hypertonic, hypotonic, isotonic, and colloids, it can feel like you are learning a completely different language. Many nursing students try to memorize these fluids by force, but the moment they enter an exam room or step into clinical practice, everything starts mixing together. The truth is, IV fluids become easy the moment you stop memorizing and start understanding one simple principle. Water always moves toward where there is more concentration. Once that clicks in your mind, everything else starts making sense naturally. Think about the human body like a collection of tiny water balloons called cells. These cells constantly exchange fluid with the bloodstream to maintain balance. IV fluids influence where that water goes. That is why tonicity matters so much. Tonicity simply describes how concentrated a fluid is compared to the inside of the cell. If you understand that, you already understand the foundation of IV therapy. An isotonic solution is balanced with the cell. There is no major fluid shift. The cells stay the same size because the concentration inside and outside the cell is equal. This is why isotonic fluids are commonly used for fluid replacement. When patients lose blood volume from vomiting, diarrhea, dehydration, or surgery, isotonic fluids help refill the vascular system without causing the cells to shrink or swell. Normal saline and lactated ringers are classic examples you will see repeatedly in nursing school and clinical settings. These are usually the safe and steady fluids nurses use every day. Now imagine a hypotonic solution. This fluid has less concentration outside the cell than inside. Water moves into the cells, causing them to swell. You can think of hypotonic fluids as cell hydrators. They help when cells are dehydrated, but they can also become dangerous if too much fluid enters the cells. This becomes especially important when dealing with brain cells because swelling in the brain can quickly become life-threatening. Understanding that fluid movement helps you think critically instead of blindly memorizing facts. Hypertonic solutions work in the opposite direction. These fluids are more concentrated than the inside of the cell, so water gets pulled out of the cells into the bloodstream. The cells shrink while the blood vessels gain volume. This can be life-saving in conditions like cerebral edema, where reducing swelling is critical. But hypertonic fluids must be monitored carefully because pulling too much fluid into the vascular space can overload the heart and lungs. Then you have colloids, which are different from the other three because they contain large molecules like proteins. These molecules stay in the bloodstream longer and act like magnets, pulling fluid into the vessels. That is why colloids are often used in trauma, burns, or severe shock when rapid volume expansion is needed. The moment you understand how fluids move, IV therapy stops being confusing and starts becoming logical. And when nursing becomes logical, confidence begins to replace fear. Now that you understand how fluid moves between the bloodstream and the cells, let's make isotonic and hypotonic fluids feel practical instead of confusing. In real nursing situations, you are not just hanging a bag of fluid. You are making decisions that directly affect circulation, organs, brain function, and patient survival. That is why understanding these fluids matters far beyond passing the NCLEX. Let's start with isotonic fluids, because these are the most commonly used in hospitals. Remember this simple idea: isotonic fluids stay where they are supposed to stay. They mainly remain inside the vascular system without causing dramatic fluid shifts between the cells and bloodstream. That makes them extremely useful when a patient has lost fluid volume. Think about a patient with severe vomiting, diarrhea, excessive bleeding, burns, or dehydration. The body needs fluid replacement quickly, and isotonic solutions help restore circulation safely. Normal saline, also called 0.9% sodium chloride, is one of the most frequently used isotonic solutions you will encounter. It is often the first fluid given during emergencies because it increases blood volume and helps improve blood pressure. Lactated ringers is another important isotonic fluid commonly used in trauma, burns, and surgery because it contains electrolytes that more closely resemble the body's natural plasma. These are the fluids you will see repeatedly during clinical rotations, emergency care, and critical care settings. But even isotonic fluids require critical thinking. Just because they are common does not mean they are harmless. Giving too much isotonic fluid can overload the circulatory system. Patients with heart failure, kidney disease, or hypertension may struggle to handle large volumes of fluid. That is why nurses constantly monitor lung sounds, blood pressure, oxygen levels, swelling, and urine output. Every IV bag hanging at the bedside has the power to help or harm depending on how carefully it is managed. Now, let's talk about hypotonic fluids, which students often struggle to understand. Hypotonic solutions contain a lower concentration outside the cell, so water moves into the cells. The easiest way to remember this is to think of hypotonic fluids as hydrating the cells. Half normal saline, also known as 0.45% sodium chloride, is a common example. These fluids can be useful when cells are dehydrated, such as in certain diabetic emergencies where the body cells desperately need water. But here is where nursing judgment becomes critical. If too much water enters the cells, they can swell excessively. And when brain cells swell, the consequences can become dangerous very quickly. Increased intracranial pressure, confusion, seizures, and neurological deterioration can occur if hypotonic fluids are used inappropriately. This is why you cannot simply memorize fluid names. You must always ask yourself one question: where is the water going? That single question changes the way you think as a nurse. Instead of panicking during exams or clinical situations, you begin analyzing fluid movement logically. You begin seeing the patient, not just the IV bag. And that is the moment IV therapy stops feeling overwhelming and starts feeling like real clinical understanding. Now let's move into the fluids that often make nursing students nervous: hypertonic solutions and colloids. These are the fluids that demand careful monitoring, sharp assessment skills, and strong clinical judgment. But once you truly understand what they do inside the body, they become far less intimidating and much easier to remember. A hypertonic solution contains a higher concentration than the inside of the cell. That means when this fluid enters the bloodstream, it pulls water out of the cells and into the vascular space. The cells shrink while the blood vessels expand. The easiest way to remember hypertonic fluids is this: they pull fluid out. These fluids are powerful because they rapidly increase circulating blood volume and reduce cellular swelling. One common example is 3% normal saline. This solution is not used casually. It is usually reserved for serious conditions where shifting fluid quickly can save a patient's life. Imagine a patient with cerebral edema after a head injury. Brain cells begin swelling, pressure rises inside the skull, and neurological function starts deteriorating. A hypertonic solution helps pull that excess fluid out of the swollen brain cells and back into the bloodstream, reducing pressure and potentially preventing permanent damage. Hypertonic fluids can also be used in severe hyponatremia, where sodium levels are dangerously low. But this is where nursing responsibility becomes critical. These fluids work fast, and if they are administered incorrectly, they can create major complications. Too much fluid shifting into the bloodstream can overload the heart and lungs, leading to pulmonary edema, respiratory distress, or worsening heart failure. That is why nurses monitor lung sounds, oxygen saturation, blood pressure, neurological status, and IV infusion rates very carefully. You begin to realize something important in nursing. The stronger the treatment, the more attention the patient requires. Powerful interventions save lives, but they also demand respect and precision. Now let's talk about colloids, which are different from crystalloids like isotonic, hypotonic, and hypertonic solutions. Colloids contain large molecules such as proteins or starches that stay inside the bloodstream longer. These molecules act like magnets, pulling fluid into the vascular space. Instead of simply replacing fluid, colloids help hold fluid inside the blood vessels. Albumin is one of the most common colloids you will hear about. It is often used in patients with severe burns, trauma, shock, liver disease, or major fluid loss. In these situations, the body may not be able to maintain blood pressure or circulation effectively. Colloids help expand blood volume rapidly and improve perfusion to vital organs. Think about a trauma patient who has lost a significant amount of blood volume. The body is struggling to maintain circulation to the brain, heart, and kidneys. Colloids can help stabilize the vascular system long enough to support life-saving treatment. But just like hypertonic fluids, colloids are not risk-free. Because they rapidly expand blood volume, they can place extra strain on the heart and circulatory system. This is why great nurses never focus only on the IV bag. They focus on the patient connected to it. Every fluid tells a story about what the body needs, what the cells are experiencing, and what problem you are trying to solve. And when you understand that story, critical care starts turning into confident care. By now, you can already see that IV fluids are not just random bags hanging beside a patient's bed. Every fluid has a purpose. Every fluid changes movement inside the body, and every decision you make as a nurse affects patient outcomes. But let's make this even easier by connecting everything together with simple memory tricks and practical NCLEX thinking strategies that you can carry into every exam room and every clinical shift. The fastest way to master IV fluids is to stop trying to memorize long definitions and instead focus on fluid movement. Ask yourself one question every single time. Where is the water going? That single question simplifies everything. If water stays in the bloodstream, think isotonic. If water moves into the cells, think hypotonic. If water gets pulled out of the cells, think hypertonic. And if the fluid contains large proteins that hold water in the bloodstream longer, think colloids. Suddenly, what once felt overwhelming becomes organized and logical. Here is a simple mental shortcut many students remember forever. Iso means equal. Isotonic equals balanced. Hypo means low, so hypotonic solutions have lower concentration outside the cells, causing water to move inward and swell the cells. Hyper means high, so hypertonic solutions pull water out because the concentration outside the cells is higher. Your brain remembers patterns much faster than isolated facts. Now connect that to patient safety. Swollen brain cells are dangerous, which is why hypotonic fluids require caution in neurological patients. Shrinking cells and sudden vascular expansion can overload the heart and lungs, which is why hypertonic fluids require close monitoring. Isotonic fluids are safer for general volume replacement, but can still create fluid overload if given excessively. Colloids stay in the bloodstream longer and rapidly expand volume, making them useful in trauma and shock situations. Everything comes back to fluid movement and assessment. This is also exactly how the NCLEX wants you to think. The exam is not testing whether you can memorize a list. It is testing whether you understand what is happening inside the body. When you see a question about cerebral edema, think about reducing swelling and pulling fluid out of cells. When you see dehydration and low blood pressure, think about restoring vascular volume. When you see fluid overload, start looking for crackles, edema, shortness of breath, and worsening oxygenation. The NCLEX rewards critical thinking, not memorization without understanding. And this same mindset applies in real patient care. Experienced nurses are not walking around reciting textbook paragraphs in their heads. They are assessing patterns, recognizing risks, and understanding physiology in real time. That confidence comes from understanding why interventions work, not just what they are called. So, if IV fluids have ever felt confusing to you, do not label yourself as incapable. Nursing concepts become easier when you stop fighting to memorize everything and start visualizing what the body is actually doing. That is when information begins to stick naturally. That is when anxiety decreases and confidence starts growing. And once you truly understand fluid movement, IV therapy stops being something you fear and starts becoming something you can confidently explain, apply, and use to save lives.